Honorable Chairperson, distinguished guest, Assalamu alaikum. Welcome to my presentation. I am Dr. Yesmin Tanjin Jahan, working as Assistant Professor in Department of Pediatric Hematology and Oncology, Sir Solimullah Medical College, Midford Hospital. I did the study under the guidance of Professor Johura Jamila Khan, Madam. Title of the article is Relationship of Initial Total Count of White Blood Cell with MRD at the end of induction in children with acute lymphoblastic leukemia. Acute lymphoblastic leukemia is the commonest pediatric malignancy and accounts for most common cause of cancer-related death in pediatric age group. At present, approximately 75 to 85% of children with ALL can be cured through the application of risk-oriented treatment protocols. This improvement of survival is due to stratify the patients according to the risk group on the basis of prognostic factors. Minimal residual disease following treatment is the important prognostic factor for ALL. In many protocols, MRD is measured at different time points such as during induction, after induction, and early consolidation. MRD is defined as the presence of leukemic blasts after treatment below the levels of morphologic detection within the bone marrow and more rarely in the peripheral blood circulation. MRD can be detected by different technique. Although MRD is the one of the important prognostic factors, its relationship with other prognostic variables have not been fully explored in childhood ALL. However, it is not well established whether MRD is an independent risk factor or associated with other risk factors. No study have been done in our settings. So the objective of this study is to identify the relationship of initial total count of WBC with MRD at the end of induction in children with ALL. This was a prospective cross-sectional study conducted in the Department of Pediatric Hematology and Oncology, Dhaka Medical College Hospital from May 2022 to April 2023. Total 30 patients are included in this study. Newly diagnosed children with acute lymphoblastic leukemia of both sexes, age ranging from 1 to 18 years, and received induction phase of chemotherapy are included in this study. And children age less than 1 year and more than or equal to 19 years are excluded from this study. Now, diagnosis of acute lymphoblastic leukemia was confirmed by complete blood count with peripheral blood film examination, morphology and immunophenotyping of the bone marrow, cytospin of CSF, and treatment was started according to modified UKALL 2003 protocol regimen A or B by risk stratification, and all patients are monitored regularly up to day 29 of induction of remission. And after day 29 of induction, from bone marrow, MRD was done in the bone marrow by multicolor flow cytometry from Department of Pediatric Hematology and Oncology, BSMMU. MRD was categorized as negative when it is less than 0.01% and intermediate when it is more than or equal to 0.1% and less than 0.1%, and when it is more than or equal to 0.1%, MRD is considered as positive. Now, result in this study, out of 30 patients, 10 patients are found MRD positive, that is 33.3%, and one patient, that is 3.4% patient had MRD, intermediate MRD, and rest of the patients are MRD negative. Now, table 1 showing the relationship among different characteristics of patients and MRD. Here, there is no significant, statistically significant relationship with age, sex, immunophenotyping, and CNS status with MRD. But in case of high risk group and patient who are receiving regimen B are more prone to develop positive MRD in comparison to standard risk group and patient who are receiving regimen A. In case of bone marrow status morphology at day 29, M3 marrow having more prone to develop positive MRD in comparison to M1 and M2 marrow. This table 2 showing the relationship between initial total count of WBC and MRD. patient who has initial total count of WBC more than 50,000 per cubic millimeter are more prone to develop positive MRD compared to patient whose total count of WBC is less than 50,000 per cubic millimeter, which was statistically significant. Here, figure 2 showing the Pearson coefficient test. Here shows there is significant positive correlation between total count of WBC and MRD status at day 29. So, this study found that significant positive correlation between the initial total count of WBC and minimal residual disease levels at the end of induction. This study also found that post-induction MRD positivity has a significant association with high-risk group, use of regimen B, and patient with M3 marrow. So, limitation of this study is small sample size and single center study. Now, study with larger sample size would potentiate the findings of the present study. We would recommend multi-center research to evaluate association of this feature with post-induction MRD. Thanks for patience hearing.